So okay, what we're going to look at now is the non-contractile properties of the hip. I'll show this through palpation on my model, and the things I can't palpate I'll point to the skeleton. Once I've told about all the bony landmarks, then I'll start talking about the joints surrounding the hip, and then we'll go over some ligaments surrounding the hip area. So if I'll just bring my model over there. Right there, Derek, could you just lie on the bed and have your knees just hanging over there as well? Right, excellent. So we're going to talk about the anterior aspect of the hip. So we'll start here, we'll bring my hand in just like so, we'll come in medially and we'll find the iliac crest, which is there. We'll move a bit more anteriorly and inferiorly, we'll find the ASIS, which is here. Then from there, we've got the, if we move down an inch or so inferiorly, we've got the anterior inferior iliac spine, which is around about this area. But to check if you're on the right area, what we're going to do is we're going to get our patient to bring their knee up. So we can bring it up there, Derek, and relax. And again, yeah, that's the anterior inferior iliac spine. And we'll keep coming down. We've got two loopy holes called the obturator foramen. We can't palpate them, but on the skeleton, that's these areas here. That's them areas there, sorry. And then we've got a superior inferior pubic ramus. Again, we can't palpate them, and they are located there and there. Then we've got the ischium bone, we've got and then the ischial tuberosity and the ischial spine, and they are located just here. That's that there. Then we've got pubic symphysis. Again, that's a joint, we'll talk about that there. Can't palpate that, and that is located there. Then what we'll do is if we could just get my model, go on the left side there. Okay, so what we've got is on the thigh, we've got a greater trochanter and lesser trochanter. The greater trochanter is this area here, the big bony prominence. Then we've got a lesser one, which is the more medial one. We can't really palpate that. That's the greater and lesser trochanter. And then we've got the we've got the head of femur and the neck of femur. And what the head of femur does is that articulates with the acetabulum, and that forms the acetabulo-femoral joint, also known as the hip joint. And that's that. And what else we've got on the thighs, the femur itself? We've got some bony landmarks we can't palpate. For example, if we turn the skeleton around, we've got things like the trochanteric line, the posterior and superior. We've got the linea aspera, which is here. The gluteal tuberosity, which looks like this rough edge here on the femur, and we've got the pectineal line, which comes from the more medial aspect of the femur. And then at the end, we've got the popliteal surface as well. And that's that. Just turn the skeleton back round there. So we're just going to bring talk about the posterior aspects of the hip there. So if you want to lie on your front there, Derek. Excellent. So again, we're going to find the iliac crest coming down, and that's the iliac crest. And I'm just going to bring your shoulders down, if that's okay, Derek. Yeah. Come down. And we should feel two bony prominences, which is the posterior superior iliac spine. Then if we come inferiorly, it's quite hard to palpate, but we've got a posterior inferior iliac spine again. And they are on the skeleton. That's the superior and inferior aspect. And we've got a greater and lesser sciatic notch. Again, we'll kind of palpate them, but these are just these big holes here. The ischial tuberosity, it's where around the medial part of the bum area. So if it's okay with you, Derek, is all right, I'll place my hand there. And it's just around about, it's the bony prominence about there. And that's the ischial tuberosity. Then we'll talk about the sacrum. So again, find the iliac crest, coming down, look at the PSIS, then come medially, slightly inferiorly, and then we're on to the sacrum there. And also we've got the coccyx, but again, we don't want to palpate that, but that is this little tailbone here. I think that's everything regarding with the bony landmarks. I'm just going to quickly double check, see if I've missed anything. Well, on the skeleton we've got other stuff as well. So we've got the posterior gluteal line, we've got the anterior gluteal line and the inferior gluteal line there as well. So with the joints, We've got the sacroiliac joint, which can't palpate on the patient, but it is just here. That's the articulation between the sacrum and the ilium. And that is a synovial gliding joint, which allows some rotation. And then we've got the pubic symphysis, which is a cartilaginous joint. And again, that can be affected in pregnancy and become a bit lax and get some pathology problems there. But then we've got the hip joint, the acetabular joint, and that is a synovial ball and socket joint, which allows a lot of range of motion there. Then we'll talk briefly about the ligaments regarding the hip area. We've got the ilium femoral ligament, which comes from anterior inferior iliac spinum to about the trochanteric line. It's got two attachments, so it comes down in two and it attaches there. This provides stability to the hip joint. Then we've got the ischial tuberosity, which comes around the back and inserts the trochanteric line again, providing some stability there as well. Then we've also got the iliolumbar ligament, which provides pretty much keeps intact the lumbar spine and the ilium. Then we've got an anterior and posterior sacral iliac ligament, and these are quite important because these are weight-bearing ligaments, and that's the non-contractile aspects of the hip.